Hello everyone, this is Faizan from PT Classroom. Today we'll see the TIBIOFEMORAL alignments. Today we'll see the TIBIOFEMORAL alignment and weight bearing forces. In that we will cover the physiological valgus and single leg stance and valgus and varus. In normal human being, see we all know that, right? Femur, tibia. In normal human being, tibia is in vertical in line, and also femur is slightly medially angled in normal human being. These two lines, the tibia in vertical middle line and femur vertical middle line, together forms an angle. That angle should be in 5 to 7 degrees, a normal angle for the normal human being. In bilateral stance, in both the legs, it won't create any problem or a forces, compressive force, distractive force. In unilateral stance, it increases the medial side compressive force. In lateral side, distractive force. Compressive force, distractive force is nothing but compressive force means the two sides are getting closer, getting towards it. In distractive force, it's getting away from it. Distractive force, see, this is distractive force, getting away. Compressive force, getting together. This is known as distractive force and compressive force. In normal angle, in case any pathological condition, the angle varies. If the angle goes greater than 7 degree, the condition is known as genu valgus or a knocked knees, because it's like knocking the knee. So it's known as knocked knees. In knocked knees, what will happen? In lateral side, it creates a compressive force. Lateral side, it creates a compressive force. In medial side, it creates a distractive force. In genu valgum, why it happens? Due to adductor tightness. If adductor is getting tightened, the distractive force is getting higher and compressive force in the lateral side it happens. In maximum happens in the cerebral palsy patients, CP patients. And obesity is also one of the factor for genu valgus. And hip abductor weakness. See, hip abductors are there. Here is the hip abductors. What will happen? What will do this abductor? It will abduct the hip and maintain. If it gets weakened, it will go for the adduction. So what happen if femur is getting adducted? Compressive force on the lateral side, distractive force on the medial side. It will happen in the genu valgum and varus. If in case the normal angle greater than 7 degree, it's known as genu valgum and knocked knees. If less than that 5 degree angle, what will happen is condition known as genu varum. Genu varum or also known as bow leg. Why? It's like bow leg. Okay. In that, same as opposite as a genu valgum, what will happen? Compressive force acts on a medial side. Distractive force acts on a lateral side. Here, compressive force acts on the lateral side. Distractive force on the medial side. Here, distractive force acts on the lateral side, compressive force acts as the medial side. It most commonly happens in the arthritic condition, rickets. These are the major factors. And also for that we give a wedging. For the treatment protocol, we give a wedging. Wedging is nothing but it's a footwork correction or also additional support or a part to add in the footwork. See, for example, in genu varum or a bow leg, the compressive medial side we have a compressive force, lateral side we have a distractive force. To balance this, we will add the lateral wedging. If I add the lateral wedging here, what will happen? Lateral side it will compress. So distractive force, here is a distractive force. The wedging will give a pressure and creates a compressive force. Here it will create the distractive force. It will try to maintain somewhat balance. For genu valgum will give a medial wedging. Wedging creates a compressive force. Okay, make sure the concept is clear. Wedging creates a compressive force. If you give the medial wedging, medial side it gives a compressive force. It like the opposite to balance the compressive force and distractive force. This is the major thing. And next thing, we have a condition known as genu recurvatum. Genu recurvatum is the condition is known as hyperextension. Normal extension is there, right? For that greater normal extension, hyper extension is known as genu recurvatum. Stay tuned for more videos.